back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman, as you can see, broadcasting a little remote. We are going to stay local, however. We're going to run over and spend a little time at MSU Health Care with Seth Ciabotti. Seth, East Lansing, Michigan is where you're housed, academic health system of Michigan State University. Tell us very quickly a little bit about that.
Yeah. We are the clinical enterprise for the university, much like the rest of our Big Ten competitors, at least in the football field, in the sporting fields. But we're at Academic Medical Center. We're a little bit different, a little bit unique than the rest of the AMCs in the Midwest, where we don't have a hospital fully on our books. But we operate as a normal health system, academic health system within the Midwest. We're about I'd say a mid-sized group. And so we're able to have a whole lot of partnerships with all the health systems across the state. And so that's just a little bit of who we are.
Well, and those affiliations, by the way, let's talk about the one that is in mid-Michigan here, and that's McLaren Greater Lansing. The Outpatient Imaging Center recently opened its doors. I had the good fortune of touring it. How does MSU Health Care partnership with McLaren going to benefit Greater Lansing?
Yeah, so as folks may know, the McLaren actually built a $300 million plus a hospital on our campus. They're much a part of a larger health system. They span the whole state, and I think even out of state as well. But that partnership is very important within Lansing, right? They're McLaren Greater Lansing hospital within the McLaren health system. We partner with them on many initiatives. I mean, how could you not? They built a brand new modern day hospital on our campus. So the imaging center was our first joint venture with them. There's many others in the queue, which folks will hear about over time, over months, maybe years. But the imaging center, it's where we brought all of our imaging services together, meaning ours and theirs, both inpatient, outpatient, dumped it into one entity with a brand new facility, brand new imaging equipment, and it opened up a couple of weeks ago. So it's going quite well.
Pretty impressive as well, and certainly brought more MRIs to the area and technology. So let's talk about navigating that current healthcare landscape and including changes in healthcare policies, technological advancements, and patient expectations.
Yeah, no, exactly. And so, so the patient expectations, before the pandemic, those are already in play, meaning we were turning into more of we had to pay attention to customer service. You couldn't, just writing a script or fixing someone's, knee or hip. It's enough, but it just wasn't enough. You have to have customer service, like a service industry, a hospitality industry, and so those changes are already in play for as far as getting all of our everyone from who picks up the phone to our physicians on how to be customer service friendly. But as far as the digital health side, the pandemic, telehealth, so that changed everything, right? So telehealth, it was kind of reimbursed and done before the pandemic, but during the pandemic and now it's fully reimbursed like a regular office visit. How long that will last, we don't know. But those things those have changed our whole digital footprint, meaning our whole digital strategy, I should say, meaning that there's, a lot of things that we do are all about not being in the office, of how we can provide. So, for example, physical therapy. Now, this is a unique one. A virtual physical therapy is something we'll be offering to patients. As opposed to going to your physical therapist 2 or 3 times a week. Now you can do that virtually with a great digital platform that we have, as well as you can see your neurologist, your primary care doctor, et cetera. But those are the things that pre-pandemic, I don't know, wasn't a whole lot of people necessarily thinking about that.
Well, it's kind of interesting because that COVID did force us into some technological advancements, and this certainly is one of them.
Yeah, well, this is one. We'd probably be in a studio somewhere.
There you go. So how do you plan to ensure equitable access to the services?
Yeah, well, that's actually it's a great question. So the going digital health wise, we can actually everybody has a phone these days, right? And really, to a degree, everyone's, internet access and a phone, regardless of, to a degree. Again, I'm not saying everybody, but if you have those things, you have internet, you have phone, you can access your doctor now. where, before you might have had to, transportation was a drawback. Well, I guess transportation would be the biggest drawback of getting to your doctor. Now, it's the internet is your transportation. And so that makes things more efficient. Again, there's still a lot of folks that don't have internet, don't have a phone, and they're struggling with access, but we're better than we were before.
You certainly hit on one really valuable point, and that is the fact that a lot of people still don't have broadband, and we've got areas of this state and even here in mid-Michigan that can't take advantage of that. But you guys are doing everything you can. Seth, we've got about a minute left. MSU Health Care plans to expand employer-based primary care clinics, laboratory services, all that stuff. Tell us a little bit about that.
Yeah, sure. So really our strategy is, healthcare is if you're a health system or an academic health system, if you're a medical group, the idea really is, you've got to go to the employers. If you think about it, large employers, and there's a lot of them in the state of Michigan, from the auto industry to, to all the large manufacturing companies and Meyer and Grand Rapids. The idea is that they are starting to take healthcare into their own hands. And so they're working directly with health systems to help to reduce their costs. And so, yeah, we're working on primary care, labs, imaging, surgeries, pushing a lot of, patients and employees to ambulatory surgery centers, which are a whole lot less cost of care than in a hospital. And so that's our strategy. You'll hear a whole lot with that coming up more.
That's with the changes in your industry. We're going to be back. We're going to be bothering you soon because I've got 8 million more questions, right? All right, Seth Ciabotti, the CEO of MSU Health Care East Lansing. That's the academic health system of Michigan State University. Thanks for being with us, my friend, and we will be back to you soon. You've been watching the Michigan Business Beat on the Michigan Business Network. I'm Chris Holman.